Hi, Elizabeth again, and I've been doing a lot of research and learning a lot about dental care, especially when one goes through a treatment or therapy, a liner therapy or whatever they call it. So basically braces, whatever kind of braces you're going to have, and how to care for your teeth. One thing I'm paying especially close attention to is gum health, because I have a tendency to brush my teeth too hard, which is not helpful. It's never helpful. I mean, it feels clean when I'm done. I'm like, yeah, that feels good, but it's not helpful because then my gums are receding. So some things I've learned that really help are paying attention to brush technique. So using good brushing technique, which means brushing down here rather than back, and here brushing up. I'm not a dentist. I'm not a hygienist. I'm nowhere in this field at all, but doing my best to figure this out. So that's something I'm going to do, holding my toothbrush with 2 or 3 fingers rather than a whole grip. So I'm not as strong, nice and gentle. Using an electric toothbrush also helps, and a water flosser I've heard is helpful. I don't have one yet, so I can't speak to that myself, but it gives apparently the nice clean feeling that I'm trying to achieve by brushing hard. The other thing, which I don't do and I should do, is paying attention to my brushing technique. Generally, when I'm brushing my teeth, I'm thinking about other things. I'm like, hey, I'm just brushing my teeth, so I'm going to focus on 5,000 other things instead of thinking about how I brush my teeth, which is maybe how I got into this position. You know, as humans, we're just not good at multitasking, right? So focusing on what I'm doing, being gentle, my gums, and using good brushing technique is probably a good idea, and something I'm going to start doing. Another thing I've learned is about retainers. Retainers are a device that you use after you've had dental work done, after your teeth have been moved or shifted, to keep them in place. And everyone knows right after the braces come off, you wear them all the time. And then after, I don't know, X number of months, whatever your advice you were given, 4 to 6 months, then you only wear them at night, and so it goes on. And eventually we all stop wearing them. Either if you have a fixed retainer, it falls out, or for me, my jaw grew and shifted underneath, and they just told me to stop wearing it, which retrospectively was not the best advice, because retainers are like a lot of other things that we use. They can wear out. Our teeth can shift, they can change. Some people have retainers that get holes in them, like the clear plastic ones, or the metal ones allow some shifting and then it hurts. Get a new one. It's not as much money as waiting until later and having to get braces again. So yeah, if I would have just gotten a new one, if I would have been advised to get a new one, because most things, most appliances in our life wear out, like shoes. Would I wear the same shoes for 30 years? Would I use the same toothbrush for 30 years? Would I use the same, even sofas wear out, or cars, or just about everything. And even things that don't wear out, like a house or a building, they still need maintenance and care. Of course, I was brushing my retainer and caring for it, but you have to get a new roof every once in a while or things like that. So if you find yourself in the situation where your teeth have settled, and you're totally fine with it, it's not a problem, but your retainers don't fit anymore, go ahead, drop a few $100, whatever you need to do, get a new one. If you feel that your teeth are headed in a dangerous direction, which mine did. Not sure which verb to use there, which is the case for me. We'll put it that way, present. It is the case for me. And so I wish I would have taken that advice. I even had a friend give me that advice about 2 years ago, and I didn't listen to it. Oops, sorry. So maybe you won't listen to me either, but at least I'm telling you and trying to help. So that's my update for today about my teeth.